Are you a healthcare professional looking for a trusted concussion resource? Then you've come to the right place. From her New York City studios, welcome to Concussion Corner with your host, Dr. Jessica Schwartz.
What if the greatest risk to rehab isn't just rest, but restriction? In part 2, our conversation with Dr. Jeff Moore, CEO of the Institute of Clinical Excellence and founding partner of Onward Physical Therapy, we go deep on what it really means to practice at the top of scope and how both environment and payment models shape your ability to deliver exceptional care. We talk about residencies versus certifications, why emotional intelligence PTs are the future of healthcare, and how the wrong clinic environment can limit outcomes, why the profession must reject either or thinking to truly serve all patients, and so much more. Whether you're a new grad, a clinic owner, or an experienced provider rethinking your path, this episode will challenge you and inspire you to think about next step in your clinical journey. Welcome to our Teach One, Serve Many community. My name is Dr. Jessica Schwartz, brain injury survivor, physical therapist, and founder of Concussion Corner, and I'm so happy that you're here. Let's begin. Jeff, welcome back to the Concussion Corner Podcast.
Jess, thanks for having me back. Pumped to be here.
I'm pumped to be with you too. And I don't know if people can handle all this energy, man. Like people come and they're like, wow, how do you do this? And, and I'm just like, I love it. So, it's just so nice to be mirrored back.
Love it. Love it. Glad to give it back wherever I can, Jess.
Fantastic. So, you know what? Listen, let's just get right into it. Let's talk about what top of scope means for you for the physical therapy profession. And let's talk about that clinically first before we get to the business side of things. But I want to say hey, how have you elevated your education from zero to now? What was your trajectory? We had a similar trajectory with residency and certain trainings like that. But where have you kind of taken from 0 years out to where you are today? We won't age ourselves. We still look young. I like to say you're welcome. I want to talk about what top of scope means to you, and I want to focus on the clinical lens first. We're going to bring it back 360 to how the financial side of things affects clinical outcomes potentially, depending on where you're working environmentally. But I want to talk about the clinical side and what does top of scope mean to you in physical therapy?
Top of scope to me means the willingness or ability to dive deep enough into topics that you can comfortably navigate the gray to best serve your patients. Jess, last time on our first episode, you had this wonderful monologue where you were chatting about avoiding rest in TBI patients acutely. And it was so cool that you're so fluent with the literature, it's nothing to you, but that's the thing, right? Like you were so aware of where you can and can't push people and what the research says. And in an area that can be a bit scary, a willingness to push right up to where is appropriate to maximize benefits for your patients. And that kind of nuanced expertise, when you hear people talking like that, it's different. That's someone who's going to get me everything they safely can and mitigate any side effects of not loading me and not providing me physical activity stimulus. And that to me is top of scope. That level of expertise that lets you walk up to that edge where you're keeping people safe, but giving them maximum benefit. And it takes a lot of time to get there. You have to be willing to dive deep into the coursework and into the programs that it takes years to where you can confidently stand there in front of a patient who's suffering and say, look, I know that we can bring you here safely and I'm going to take you on this journey. To me, that is the attitude and kind of the background that someone who's practicing top of scope comes into a patient encounter with.
Now, we've been educating for quite some time now, and I want to talk about that's confidence is there. However, if the differential diagnosis and ability to kind of have that emotional intelligence to reach across the aisle, to reach out for help or refer to the proper person first with direct access, physical therapists in this country, we're in over 60 countries, physical therapists in the US have direct access to patient care. So there is a little bit of a difference of you have more of a novice provider that may have that swag and may connect to some of the things that you said, but then may not have the clinical know-how and prowess. Where has your educational know-how and prowess kind of led? What was your journey from 0 years out to where you are today?
Yeah, Jess, that is so true that people don't know what they don't know. And I can't fault them for that, but have a healthy humility early on in your career because there is a lot that you don't know and a lot of it will impact how your patients recover or fail to. So get on the learning train. And I'm not just saying that because, I run ICE Physio and we've got Con Ed courses. I'm saying that because it's a journey we've all taken and we know what the other side looks like. And so for me personally, I got out of school. I just asked my professors, like, who's the best out there? And they just pointed me around. I went and took every course I could. The first couple of years, I took 3 different certification tracks and was just trying to soak up this knowledge from everybody. And then, very similar to you, bumped into the evidence in motion folks, and they were crushing it with their residencies and fellowships. And so I jumped into that and spent very challenging years, but very rewarding years, with these folks, dissecting your cases and your reasoning, and always on the hot seat. It's a lot. But had I not went through a lot of that rigor, I don't think I'd have the confidence that was earned, in the way that it was, 7, 8, 9 years after graduation. And so for me, that was it. A lot of individual certifications early on, then settling into a fellowship program, spending a bunch of years in one spot. The combination of those two was really potent.
And how does the manual therapy fellowship that you did, how did that change your career?
Gosh, I mean, it's funny because the first thing that your listener is going to think is like, well, he became a better manual therapist. And that would be true. I got a lot more confident that I could provide some temporary relief by doing manual therapy things. But it's so much bigger than that, because it's really the reasoning that surrounds the incorporation of manual therapy and combining it with exercise. Being able to have any patient walk in and be so confident in your clinical reasoning framework that you're going to be able to get them organized and moving forward, that is an unbelievable transformation in your career. And that's what it did for me. By the end of it, I really felt like it doesn't matter what you show up with, the way that we're going to go about this process, I know that we're going to get you moving in the right direction. It was probably more so that than any sort of expertise with individual techniques.
Yeah, and again, at as a doctoring profession here in this country, I make it really clear for the folks that I've educated throughout the many years is that the difference between us, again, thinking about you with like your expertise in manual therapy, manipulation, grade 5 manips and things like that. If you're doing a straight leg raise and all of a sudden you light someone up because of neural tension and other things that might be going on with that lumbar spine or with the nerve or something's adhesed somewhere along the chain, we can write a whole dissertation on a straight leg raise. But again, if someone may be injured who's novice or not a doctor of physical therapy and doesn't understand that a straight leg raise can totally light someone up with HNP or low back issues. Same thing for me on our side at the Academy for Concussion Corner. We're saying like, hey, are you putting someone in bird dog and are they having a total dysautonomia situation, or do they not have anything going on sensory motor wise with their upper cervical spine? They can't look up, they can't extend, therefore they can't, have superior gaze or gaze stability or holding, and then all of a sudden their heart rate's all over the place and they're just doing a bird dog position, which is so benign, but again can make someone so flared up. And that's why I use that straight leg raise for people in your world and that ortho world and sports world, because people can connect to that. Like something so seemingly benign can be so provocative. But again, we've got to kind of go through that rigor, right, to get there, to have these conversations.
Totally. And then when you're there, to be able to not abandon ship. And this kind of comes back to like our avoiding rest at all costs. But if you are novice and you flare somebody up with a straight leg raise, the patient's kind of upset. Like they're now miserable. That pain is back. Do you have the ability to, versus abandoning ship, say, well, hold on, how could I position them? Could I bend that top leg and still do a bit of a lumbar roll and get some movement there? You've got this litany of techniques and ability to moderate your load and your dose based on irritability that you can still serve those people. And again, that just kind of is that top of license, nuanced expertise that we really want to encourage folks to get to. So they're not just saying, hold on, this is too hot to handle, we're going to do nothing, because nothing is never the answer.
Yeah, fantastic. And again, it's like, as a clinician, you are going to have those holy moments of, lighten someone up if you're working with back pain and concussion. And it's just the bottom line. And what I find with those novice clinicians or folks that don't have that high emotional intelligence, high EQ, they may be high IQ or maybe mid IQ, who knows, but they don't have that high EQ, and then they panic and freak out and then blame the patient. And then it's like, oh, that shouldn't have done anything like that, or that you shouldn't have all that discomfort. And then you're totally losing a therapeutic alliance with the patient. You're also making them feel crazy, and they already feel crazy because they don't know why they don't feel well. And for me, again, as brain injury survivor, you heard this in 2015 when I first told my story in Colorado, but it's like, hey, we do not have the subjective language to express the what and how we feel with brain injury. And the bottom line is, I just had a neurooptometric exam. I'm over 10 years out from my brain injury. And I just had a neurooptometric exam because my eyeballs are my handicap. I have a vision handicap and it's ocular motor based. So it's like, hey, going for a tune-up, cross that 4th decade of life, we'll whisper that into the mic. And it's like, hey, I just want to make sure I have ocular health, checkup. So I did my ocular health checkup and then went over to the neurooptometric side. Dude, I had an ocular migraine for 5 days. And I was like, talk about feeling nuts. Reached out to our neurooptometry colleague at Concussion Corner Academy. And she was like, Jess, you're going to be fine. You've gotten through this before. You're totally just flared up right now. This is where your handicap lives. Give yourself 5 to 7 days to chill. And then in that 6th day, boom, I started to feel better. But again, what are you seeing from a patient perspective of like some language that might be helpful to kind of settle folks down if they get flared up because of a treatment that you did?
Totally. One of the big things, first of all, is just expectation setting, right? That, hey, we're going to play in this area and there could be some of this and it's not the end of the world, right? And we've got abilities to bring it back down on the other side of the mountain. So like their willingness, it's crazy, but sometimes flare-ups can build confidence. And what I mean by that is if you can keep your head and you can create some relief afterwards, all of a sudden they're like, oh, maybe I can kind of go right up to that edge because he was able to show me these 2 things right after that settled things right back down. So all of a sudden your, again, nuanced skill set to be able to help someone recover in real time can make them say, gosh, I'm getting more confident, even though I had a symptom flare, than I was before we had the issue. And so being ready and able with those techniques is massive.
Yeah, fantastic. And we do the same. So for example, if you, had a flare up for 10 to 15 minutes or an hour, I want to say, you know what, we're not going to run away from this because we don't want to instill fear avoidance in our patients that movement is bad. And we see that whether it's dizziness or pain or discomfort, you see a lot of the same thing on your side with, low back pain and other chronic conditions that you guys treat. What I'm going to say to the patient is we're not going to run away from this. I'm so sorry for this experience that you're having right now. Let's make sure we get you to feel better and we get you home safely and so you can kind of recover. But when we come back to this, if it's in a day, if it's in a week, it's in a month, I want to make sure that when we go there, we cut your symptoms down by half. So we're going to dose that. And that all comes down to frequency, intensity, duration, just dosing and having the high IQ component to work with the EQ component of someone who's actively uncomfortable in front of you that, it's just, hey, your body, and I shift it around too. It's like, do you think that this big experience that you're having right now, which is very real, kind of makes sense to what we just did? And they're going to often say no. So shifting that back around and say, like, you know what, your body just wasn't ready for that right now. And we're not going to run away from it. We're going to cut it down by half or a quarter next time we address this. And we're going to see how your body recovers next time. And we're going to keep going incrementally. And then that's where we talk about pace grade exposure. And that's what we're seeing, across all of rehab. Now, with that being said, we've talked about your clinical know-how, your expertise, and that's what it truly is. Let's shift that, because if we're not able to do what we were trained clinically to do at top of scope and our environment changes, for example, my environment for my brain injury, environmentally, I cannot perform to my top of scope as Dr. Jessica Schwartz if my environment's not set up for success. Now, let's talk about the clinical side of things, not as a brain injury survivor. For folks that you're training, if their environment doesn't set them up for success for the clinical piece that they need to connect to, what are you seeing there? And why did that Instagram post that you posted on July 25th, what was the impetus for that? And let's talk about that and lean into that hard.
Yeah. So first, I just want the listener to hear the importance of that. Without the right tools, you can't perfect the trade. We have to accept that, right? I mean, if you've got people who are coming in and they've got acute TBIs and they've got significant vestibular things, you have to have a certain environment. You have to be able to manipulate it subtly. You have to have the right tools to work with. If you're coming from our side of things, from ICE Physio, we're best known for being fitness forward. If you're going to do the things that we're educating you to do for the patients that we treat, you need to have the right tools. You really can't do this without a good squat rack. That sounds crazy, but it's for the people we treat and the way that we do it. There's sometimes you have to put enough load on things, right? We always say that load instructs and it makes a lot of things jump out and it makes a lot of things possible. If you don't have it, you can't do this in the best way possible. And so I think no matter what you want to go into, you've got to think about what tools are essential and stop giving yourself a hard time for not getting great outcomes if you don't have them. You might not be in the right environment. And you might need to either challenge the powers that be wherever you're working. Hey, can we get the stuff I need? Or, as I often counsel a lot of people, you might need to make a shift so that you can get the stuff in the setting you need so that you can be your best as a clinician, because it does require that.
And now, a word from our sponsor. Did you know that sport helmets are rated on a 5-star system similar to cars? And the safest helmets have nothing to do with price, brand, or availability? Since 2011, Virginia Tech researchers have been providing unbiased helmet ratings that allow consumers to make informed decisions when purchasing helmets. The helmet ratings are the culmination of over a decade of research identifying which helmets best reduce concussion risk. This work is done as part of Virginia Tech's service mission and is 100% independent of any funding or influence from helmet manufacturers. Our mission at Concussion Corner is to expose you, the listener, to trusted spaces in the concussion arena that translate to clinic next day. Please visit the Virginia Tech Helmet Lab website in our show notes or at bit.ly/Virginia Tech Helmets and spread the word to aid in lowering concussion risk in your community. Thank you for tuning in, and let's begin the show. Fantastic. And, my partner is a graphic designer, so something completely out of, does motion graphics, VFX, 3D, 2.5D, all the things that I have no knowledge about. She just makes us look really cool at the academy because she edits all the things.
Love that.
But at the same time, so we just talked about the clinical know-how and being top of scope, there with learning and all the decades that you've spent learning, and then talking about environment. But again, you can't have like a Mac computer that's like fully loaded with Adobe Premiere and Final Cut Pro and all the things in there and then not know how to use it. And vice versa, you don't want to take all that skill set that she has as a double BFA and then work on a Google Chromebook. With that being said, what was the post that you made on July 25th? And what do you want to see change? And what was the driving factor? Because I mean, really, that was like taking a tablecloth and pulling it off a table and let's just shake up the whole system.
Yeah.
I'd love for you to comment on that. And we'll put that post in our show notes for people to look at as well.
Beautiful. So we kind of went at this a couple different ways, but we're always trying to figure out like what is limiting people from being able to be their best? What's limiting our profession from being able to be its best? And so one thing we just spoke to, you got to have the right tools, but you also have to be in the right model, right? And so we talk a lot about in-network versus out-of-network practice. So our clinics at Onward Physical Therapy are 100% out-of-network. So we've got 42 locations, coast to coast, wide variety of geographies, wide variety of owners, got a really good idea for where that kind of model works. And we are stoked about it, Jess. Like I am as enthusiastic as anybody else about the ability to remove ourselves away from some insurance company limitations with certain patient demographics that really allow us to be best in class for those people. But, and this is so important for your listeners to understand, and young clinicians especially, that is for some people. The big win as a profession is for us to provide excellent physical therapy to all people. And what I really want us resonating on is if we are going to be able to bring top of care best in practice to every single human in the US, to be able to mitigate so many of the challenges that we've struggled with health-wise in this country, we need to meet everybody where they are. And everybody can't be in the out-of-network space, Jess. That doesn't make sense. Like there are plenty of people that are in institutions where their insurance is a huge part of their payment package for their salary, and they need to use that. The income's not available for other things. There are times where, think about Medicare, think about Medicaid, there are so many reasons in so many ways that people show up that don't make them conducive to being in an out-of-network payment model. None of this is right or wrong. What matters is we understand as a profession that we don't get so excited and so myopic about, oh, this is the best way to do it. No, this is a new, exciting, great way to do it. And we should be there while we continue. We're offering great care in all these other environments that have their own challenges. We don't just jump ship. We keep all of these posts manned and women to make sure that we're crushing this rehab discipline for anybody who needs us. And if there's one area I want to be a voice, Jess, in the next 5 years, it is going to be not allowing us in the same way that we got so excited about manual therapy only or exercise only 20 years ago. Here we are again, where people are now getting polarized around a payment model. We don't get to do that, Jess. Our job to the country is too big for us to get myopic on these models. We've got to be everywhere, and we need to keep an and not or focus.
Yeah, and I think, just thinking about the synergistic roles of manual therapy and exercise, right? We just had Dr. Julia Trelevan on, who's one of the world's leaders in cervical spine or cervical spine if you're in Australia. And, again, it's like, it's not either or, it's both. And again, I think if you're that myopic in your viewpoints, I think it also says a lot about the clinician, and it's maybe not be someone that I want to actually engage with as well. We're not going to talk about politics, but again, just kind of shifting lenses of like, can you do both? And can you say, hey, you know what? I need you to see a pelvic physical therapist that's in a private space to do some internal work with you before you come back to me, and make sure that we're referring properly and then treating them again. And it's not like a full discharge, I'm never going to see you again, but it's just knowing what's right for the patient and how we can serve the population of patients that are in our community. And again, are you in a primarily Medicaid community that may be in Alabama or Mississippi or in Florida? Or are you treating some folks in Colorado that are like, doing the Olympic Training Center stuff, and they just need to have some really high-end care that's really specific that you guys have training in? So, it's so nice to hear the conversation. It's so nice to see you push the boundaries of where we need to be. And at the end of the day, physical therapy, rehab in general, we just need to be amplifying what we can do for folks and elevating those conversations so that we're treating our communities the way in which we can, again, top of scope. And then it takes that high emotional intelligence, that EQ, and that comfort within ourselves to say like, hey, here's how I can help, and here's our network. So, it's just fantastic to see what you're doing.
Jess, I love that you said that, because that's what's bothering me the most. You just said perfectly, we've got to be amplifying everyone who's trying to do a great job, right? And right now, you're seeing, because it helps on social media, polarizing opinions are very attractive from like a growth perspective of attention. So unfortunately, that's true. But what we're seeing now is that people are saying, this is the only way you should be practicing. Everybody else is wrong. Think about how devastating that is, especially if you're being looked up to or that person's following you. For someone who's working their butt off in an insurance-based model that does have some challenges, you got to see higher volume. You're oftentimes using text and aids, but you're doing your damn best. And you're providing services to folks that otherwise aren't going to get anything. And now that person's feeling less than when it's one of the people that we're supposed to be locking shields with to bring quality physical therapy to this country. Like, we cannot be doing that to each other. We got to be looking at what's everybody doing well and right and amplifying, not diminishing other people's efforts. So that's where we've got to go with these payment models.
Yeah. And at the end of the day, high volume clinics are very real. And I just say to patients, and just even friends and colleagues and family at this point, it's like, I live in New York City. If you're going to put Picasso in the middle of Times Square and tell him to produce 4 paintings an hour, what are you going to get? Yeah. Better than I can do for sure. But at the end of the day, is that Picasso quality, and is that the best that I can do? So I think that really ties into, as we wrap up this episode, just talking about environment, how environments can shape your clinical outcomes, how environment can shape your physical outcomes as a clinic owner or a clinician. And just from a brain injuries perspective too, environment has completely changed my world. So I negotiate into contracts, I understand what the lighting is when I'm going to speak publicly. I just spoke in Switzerland, hey, I just need to know what's going on. If I have a safe space to kind of go on and kind of just let my sensory system kind of just chill after just giving a 45-minute speech, things like that. So environment is so important for our patients' outcomes, and for our outcomes. And again, we have to be able to fill our own bucket, but we also have to know how to navigate that, how to fill that bucket. And again, we don't get a lot of coaching in that in PT school. And we're just so lucky to have you going around with your energy on flights, road trip. And I see you all over the country, just doing your thing. How many flights do you fly a year?
Yes. So it's funny you say that. So, I fly about once a week, sometimes twice a week. But what's really funny is I bought a Harley, right? And I've got a couple motorcycles, but I'm really into motorcycles. And I thought, you know what? I'm done flying. I've been flying so much for so many years. So what I'm doing this fall is I'm doing the whole tour on my motorcycle. So I'm going to all these DPT programs and giving this lecture. And it's already, the September dates are all sold out. I've got one more. If a school in the Southeast wants to hear the lecture in October, I could fit you in. But I'm driving this motorcycle all around the country and going to all these schools. And I'm going to give this lecture on out of network, in network practice, and not or. And so this topic we're having, I'm going to give it to students because I think it's the best spot to go, to let these kids know, like, don't let the polarizing opinions get to you. Understand there's value for you everywhere, and that our mission is so huge and you're a valuable part of it.
Fantastic. As we wrap up, I want to make sure we touch on it. We talked about it before, for behind the scenes for folks. But let's talk about residency. We have an issue at Concussion Corner Academy a little bit different than you guys, where we don't provide a certification specifically because the Brain Injury Association provides that certification for brain injury. And the American Physical Therapy is now doing a brain injury certification that I actually was fortunate enough to give the concussion lecture on. However, for me at Concussion Corner Academy, we're a small biz. We want to make sure we're doing the best that we can with the top 1% of clinicians, if not top 0.05% clinicians who are writing the international documents, the American Academy of Pediatrics, international consensus concussion guidelines, and things like that, and kind of just stay in our lane that way. So we don't provide a certification. On your side of things, why aren't you doing a residency? And also, just for our listeners to know, there are over 43 working definitions of concussion. One of them is evidence-based. So we don't want to be providing that, from our company. And that's just
Sure.
and what also brings our faculty in, that we're not providing certification. But on the flip side of things, you guys do provide certification, which is okay in that space for what you're doing. What are you doing in terms of residency, and why is that a similar conversation for you, whereas certification is for us?
This is a hard conversation because I got so much out of the residency and fellowship I did. So it's always tough for me to speak to why we don't do one, but it's an important conversation. The reality of it is, Jess, you really looked at, so we could do this, right? Like, we have the resources, we've looked at it. Logistically, it would be
got the faculty for sure. Yeah.
We could totally do it. But it is when I look at what I want to offer clinicians who are going through ICE physio, I want them to get maximal clinical and business impact for the smallest unit of time and financial investment. So I am hyper focused on that. The unfortunate part of accredited programs is there's a lot of boxes to check. There's a lot of paperwork. There's a lot of patient logs. None of that is making you better at getting outcomes. And we were happy to tolerate that I won't speak for you. I was happy to tolerate that. It was part of the process. But I think part of our job is, as continuing education evolves, we have to keep concentrating the value. And I think right now that having accreditations that require a lot of time and bandwidth spent that are outside of developing clinical excellence, I think people are coming out of school with too high of loans and too tight of time to be able to tolerate anything that doesn't have almost 100% time investment, clinical expertise, and financial return. So I'm trying to keep that as clean as possible. In some of these larger programs that have more layers of admin, don't allow me to do that. And so ultimately, that is what has kept us away from it.
Ditto. Just ditto. And we're able to provide CE in all 50 states for PT,
Totally.
OT, AT. We can do speech therapy, PA, and nursing if we get 10 of those folks coming through. And again, at the end of the day, we feel exactly the same. And we're not an online, just post and go. We have coaching 2 to 3 times per week with myself for all of our students that come through. They get to meet our faculty live, which if you go to a big conference, you don't get to do that anyway. So you really get to build rapport with our faculty, who are, again, at top 1%, top 0.5%. And we feel the same way. It's like, where can we maximize? And that's really just putting our education, first, and just leading with excellence. So again, if we maybe had 20 other people on staff and faculty and that could do administrative work, maybe that would be the case. But again, 100% with you there. So I'm just glad to see you leading the way.
Yeah, thanks so much. Yes, it's a tough balance, right? And again, this kind of goes back to the in-network, out-of-network conversation. I'm glad there's residencies available that are crushing it. And I'm not here to say that, they shouldn't be out there. I'm just saying we're going to try to provide something a little bit different in our space. And again, I think it can be and not or.
Yeah. And again, for our side of things, Brain Injury Association, and not to poo-poo them at all, they've been trying to build this thing for years. And it's a huge amount of investment, time, production, skills. And if we didn't have Greystone Graphics, helping us out with all of our visuals and our, it's about 40 hours per week. We have 24 weeks, that have been built with all fully accredited CE. So again, you got to just stay in your lane sometimes. And again, we're just doing it. We're doing it well. And so are you. And I'm so happy to have you on. Where can folks find you? What courses do you have going on for fourth quarter, first quarter, 2026? Speak to us.
Totally. As far as courses, Jess, we run 24/7 now. We used to ebb and flow and slow down in the summer. Those days are long gone. If you want to grab one of our courses, we have a dozen or so available live every single weekend across all corners of the country. We're up in Alaska often. Courses crush in Alaska. People love getting up there. So if you want to go see Alaska, we're up there quite a bit at Denali Physical Therapy in different areas. Our online courses run every 8 weeks. This is true all year long. So whatever you want to jump into, it's going to be available. As far as communicating, the ICE Physio app is the best way to go. If you download, it's a free app. By the way, download the app no matter what, because even if you don't want to communicate with me, there are so many cool resources in there that our faculty have built with free workshops. And if you're trying to find a friend or family member, a PT, we've got to find an ICE trained PT on there where you type in the zip code, all the ICE trained clinicians and their expertise pop up. Like, we want to be able to take care of people, even if you're not involved in our coursework. So hop on there. But if you message me on there, it's the first thing in my world that I check every morning. It's the fastest way to get to me. But Instagram is Jeff Moore DPT. Gmail is jeffmooredpt@gmail.com. Use any and all of it. I'll get back to you right away.
Fantastic. If you can leave our audience with one thought before you go of, where you hope to see the physical therapy profession in the next 5 years, what are you hoping to see?
The future is just so damn bright. If you want me to leave the audience with one thought, the future is so bright, because where people tend to be reductionist in saying that this model doesn't work now and this and that, the exact opposite is true. What we're doing is simply working in more and more areas. And we're seeing rehab and PT get involved in spaces that we never existed before, that we're now pushing boundaries in. And if you're a young clinician and you're coming into this profession right now with widespread direct access and a public that's more and more aware of the power of conservative care and all these different models where we can meet people everywhere, it's just unbelievable how much opportunity is showing up, and the amount of good that we can do is becoming exponential. And I will leave you with that because I think it's the truest thing in the world.
Fantastic. And I agree 100%. When people say, don't do this, I tend to do it and tend to go the opposite lane. And again, same thing for us. People said, hey, there's no money in concussion. There's no money in brain injury. There's, how are you going to build this thing? And I was like, I'll figure it out. Don't even worry about it. Let me just take care of it. And we'll just, if you build it, they will come. And, at the end of the day, we're the only interdisciplinary concussion education academy doing this the way we're doing it. So I'm just so happy to be having these really high level conversations across the aisle, making sure we're building up all of our folks. And let's definitely get some ICE physio folks on. Let's talk CrossFit. Let's talk about autonomics. Let's talk about physiological side of things for maybe concussion patients and athletes that want to get back to CrossFit. So let's do that actually in a follow-up with either yourself or one of your guys or gals.
Yeah, it's a plan, Jess. And thank you again. I say this to you every time I see you, but the concussion space needed you so bad, because up until you all developed this academy that is as comprehensive and interdisciplinary, it wasn't there. And again, I'm not trying to be negative about other things, but this level of concentrated education and expertise, we are pushing people your way all the time. So thank you for being there in developing the clinicians that you are.
Yeah, thank you so much. And we'll shoot over a little discount code for your folks at ICE and Onward. And listen, keep doing what you're doing. Keep shining bright for the community. We're so happy to have your voice still as energetic as it is. And again, just keep shining bright, and we'll make sure to keep following you.
Awesome. Thanks so much, Jess. Appreciate you having me on.
All right. Take care. That's a wrap on part 2 with Dr. Jeff Moore, a clinician and educator who's not only moving the profession forward, but lifting others up as he does it. If this conversation hit home for you, whether it's the importance of clinical depth, the challenge of high volume environments, or the need for and, not or thinking, consider it an invitation to keep going. For our Institute of Clinical Excellence, Physio, and Onward Physical Therapy community members, we've got a special discount code that you can get directly from Jeff or within the ICE Physio app. If this episode resonated with you, please subscribe, rate, and share the Concussion Corner podcast with your community. Every listen helps us amplify compassionate interdisciplinary care around the world. And if you're ready to deepen your skills in concussion assessment, treatment, and recovery, we'd love to welcome you into our global learning family at Concussion Corner Academy. Our philosophy is simple: teach one, serve many. And if you're enjoying, please rate, subscribe, and share wherever you listen and on YouTube as well. Every review helps us amplify trauma-informed, compassionate care for brain injury survivors around the world. Thank you for tuning in, and thank you, Jeff, for being a guiding light in our field and someone I can call a friend. We'll see you next time with both bold conversations on compassionate care and concussion education at the Concussion Corner Podcast. Thank you so much for being a part of our Teach One, Serve Many community, and take care.
Thank you for listening to the Concussion Corner, hosted by Dr. Jessica Schwartz. The information in this podcast is for entertainment purposes only and not to be used as personal medical advice. Don't forget to follow us on social media on Facebook, Instagram, Twitter, and YouTube at Concussion Corner.